Hi everyone, how you doing? My name's Stephanie and I teach people how to reduce, take a break and stop drinking. And I've had some requests to do some more detailed educational videos about alcohol. So the best book about facts relating to alcohol is Drink by Professor David Nutt. So if you're interested in learning more, check that out. I will post some links with this video as well where you can get more information. So essentially this video I'm going to go into more detail about the long-term impact of regular drinking on the body. I can't be specific about amounts. If you've seen any of my other videos, you'll know that there are so many factors involved. Yes, amounts play a part, binge drinking, regular drinking, but also genetics and lifestyle play a part in this as well. That does not mean you can game yourself out of this by eating vegetables. The bottom line is alcohol is a toxin, it's a poison, and at some point it's going to get you in some sort of way. Yeah, whether it gets you next week or in 10 years time, it's definitely going to get you. Now, I have run 3 different treatment services, 2 of which have been alcohol specific. So yes, a lot of what I'm talking about is factual research, evidence-based, but also it's based on what I have seen working with thousands and thousands of people in alcohol treatment services. The most common things that we see across the population in the UK. So I'm going to include low-level stuff as well as the more chronic stuff as well. I'm going to start, I may not actually, I'm not going to say that. I was going to say I'm going to start at the top of the body and work my way down, but I'm probably not. Anyway, I'm going to start with the brain. So I have done a video, a more detailed video about all the different ways that alcohol impacts on our brain, because there are many different ways. So I'm not going to go into a huge amount of detail here. The bottom line is, please remember that alcohol is a toxin, it's a poison. When you drink it, it goes into your stomach and it goes into your blood, and your blood is everywhere in your body. So not one part of your body gets away with not having the impact of alcohol. Now, this is where genetics and lifestyle play a part. Like I've said before, you and I could go out drinking and we could drink the same amount for 10 years, but depending on our genetics and lifestyle will depend on how that impacts on our body and our brains. For some people, maybe the liver is a problem. For some people, it might be pancreatitis. For other people, it might be mental health, yeah? Heart problems, stroke, cancers. These are the most common ones that we see. So brain, it kills our brain cells, essentially. So what happens is over a period of time, we have a decline in our IQ. There, it can also impact on dementia, Alzheimer's and vascular dementia as well. And in extreme cases, it causes brain damage. Now, I want to be really clear here. When I'm talking about brain damage, I'm talking about when somebody needs to be cared for, 24-hour care, so under a guardianship order. So very serious brain damage. We don't see this very often. So this is something I get asked quite a lot about in trainings. You know, they've heard about Korsakoff's, about brain damage, you know, and it's like, oh, it's really common. It's not actually, it's incredibly rare. So if you think about, you know, in alcohol treatment services, I can think of 2 people that we dealt with that had very serious brain damage to the point that they needed 24-hour care. Now, it doesn't mean that we get a free ticket, because obviously what we're seeing is a rise in dementia and Alzheimer's and things like that. Memory problems, that's really quite common. So one of the things that we used to educate GPs on, and just the general population. So as we get older, a lot of people will say, oh yeah, it's just because I'm getting older, it's my memory. Actually, that isn't a reason for your memory to decline, and we would want to be doing some tests on that, and alcohol would be one of the questions we would be asking, you know, how much are you drinking? Yeah. The other problem with alcohol is it can massively impact on your mental health. It can increase, cause and exacerbate anxiety as well as depression, and in extreme cases can cause fits in the withdrawal as well. It actually changes the physical shape and structure of the brain over a period of time due to the toxic effects of alcohol. So remember that alcohol is a poison. I'm going to keep saying that. The other thing as well is alcohol can impact on our ability to process certain nutrients. And then so the lack of certain vitamins, B1, thiamine, that can be an issue for our brain as well. So one of the things, if somebody is a regular drinker and they've been a regular drinker for a period of time, we get them to go and see their doctor and get some thiamine, which can help, because alcohol can stop the body from absorbing certain nutrients. The other thing as well is if you already have a pre-existing mental health problem, it's not going to help you. Remember that alcohol is a drug and it alters the way you think and feel. The other thing that we used to see a little bit more of was peripheral neuropathy, which is the nerve damage, tingling in the hands and feet, but can also be about balance, stuff like that, how people walk. Again, fairly extreme, not as extreme as the brain damage, but and there can be other reasons why somebody might have peripheral neuropathy, diabetes, but then of course alcohol can contribute to diabetes as well. It can have that sensory and motor impact as well. We didn't see, like I said, not a huge amount of it, and I think we used to see more of it in women than we did in men. Then cancers, more common. So if I think about, when we're running groups in the community, it was not unusual for people in those groups, for a number of people in those groups to be experiencing problems with different types of cancer, liver problems, pancreatitis, stomach problems, depression and anxiety. They were probably the most common ones that we used to see a lot of. So cancers. Alcohol can increase your risk of 7 different types of cancers. And those different types of cancers are mouth, upper throat, larynx, esophagus, breast, liver and bowel. Now, just because you drink, it doesn't mean you're definitely going to get cancer, and just because you don't drink, it doesn't mean that you're not going to get cancer. It increases your risk of getting cancer, okay? And it does that because alcohol damages our cells and stops our cells repairing the damage. It also affects the chemical signals which can make cells divide often, and alcohol makes it easier for cells in our mouth and throat to absorb harmful chemicals. It can also cause changes in hormones, which can also impact on our cancer risk as well. So there's lots and lots of reasons why that happens. So if cancer risk is something that is a problem for you, one of the best things you can do is massively reduce your drinking or be alcohol free. Then the other one, let me just see where we got to, liver. The other one that's common is liver. Now the trouble with alcohol related liver disease is, unless you have regular tests, you probably wouldn't know you have it until it's quite serious, really. So symptoms of alcohol related liver disease are feeling sick, weight loss, loss of appetite, yellowing and the whites of eyes, swelling in ankles and tummy, confusion, drowsiness, vomiting blood or passing blood in your stools. But the liver it's amazing. So the liver filters toxins from your blood. So alcohol is a toxin. So if you're drinking a lot of alcohol, then your liver is working quite hard. And if you're doing that a lot, you can see where the problems come in. It aids the digestion of our food, it regulates blood sugar and cholesterol levels, all of which alcohol impact on as well. The good news is the liver is really resilient and capable of regenerating itself. That doesn't mean we shouldn't look after it though. One of the really sad things that we started to see in alcohol treatment services were women coming in sort of early 20s and upwards having problems with their liver. So one of the things that you can do if you're concerned about the impact on your liver is go to your doctors and ask for a blood test. That's the first thing that they'll do. Now the problem with that is a blood test doesn't really show if we've got problems with our liver. So sometimes you can have a blood test and it will show that certain levels are not as they should be, and normally the doctor will retest again in 3 months because the body is ever changing and you can take snapshots of something, hence why it's really hard to test hormones, things like that. It's the same with the liver. The only way to really know is to have a scan. So if you're able to, if you're really concerned, if you have a couple of blood tests, the doctor will usually want you to do that, and you can insist on having a scan. That really is the only way to check that, or maybe you can go private as well. Now the other problem with the liver is that when the liver gets damaged and it gets scarred, it's harder for the blood to move through it, which increases the blood pressure. Now, alcohol also increases blood pressure as well anyway, because of the way it works with the heart, the way it works with our body. So it increases the blood pressure around your intestines, and then blood must find a way back to the heart, and it creates smaller blood vessels, varices, which are not designed to do this. And this is where we get into trouble with things like internal bleeds, esophageal bleeds, stuff like that. And that's the other thing that we have seen as well. Now, I'm talking a very serious sort of top end here, alcohol related liver disease, varices, esophageal bleeds. But, if you are somebody that has a 10-year history of binge drinking regularly, or just significant amounts regularly, maybe a bit more, this is where our genetics and our lifestyle can play a part in this as well. Heart is the other thing that can happen. So yeah, alcohol can impact on our heart in lots of different ways. So alcohol can impact on weight gain. It can raise our blood pressure, which we know the liver, it's all interconnected, isn't it? So it's hard to sort of take different organs. Alcohol contribute to heart failure. It can contribute to strokes. So one of the risk factors for strokes is high blood pressure. Alcohol can cause high blood pressure. Diabetes as well, alcohol can impact on that too. And irregular heartbeat if you drink too much too. So there's all these things sort of interlinked. I think the key bit to remember, I find really useful, is alcohol is a toxin, it's a poison. So if you ingest alcohol in significant quantities, probably more than a couple of drinks every so often, you are effectively poisoning your body in some way, and your body has to deal with it. Your body has to work hard. So you're drinking the alcohol, it's going into your stomach, and the toxin, the poison, goes into your blood, which goes to every part of your body. So it's going to your brain, impacting on your brain cells, it's impacting on your blood vessels, it's impacting on your blood pressure, it's impacting on your heart. Your liver has to work hard to process it. Your liver's really good and it can handle quite a lot of stuff, which is amazing. And then we get into our stomach. Because it's a toxin, it's a poison, it can really irritate the lining of the stomach, and cause swelling and inflammation. Over-acidity, anxiety and depression were the most common things we used to see in alcohol treatment services. People being prescribed antidepressants, probably 70% of the people prescribed antidepressants, blissfully unaware whether their alcohol use might be impacting on that, and the other one was being prescribed medication for over-acidity. And 9 times out of 10, when people reduced or had a bit of alcohol-free time, they felt so much better. They did not need their antidepressants, and they definitely didn't need their over-acidity medication. Now, unfortunately, what can happen is if you continue drinking and you're not really listening to your body, so you're having trouble with heartburn and acid reflux, and it's really irritating the lining of your gullet and your stomach, and you're starting to get swelling and inflammation, then in more extreme circumstances, we're looking at ulcers. If people are vomiting regularly, that would be a warning sign. I would be wanting you to go to your doctors. Are you bleeding? Are you bringing up blood? Are you bleeding? Is there bleeding in your stools? That type of stuff. Yeah, and that's when we're getting into the more serious top end. So sort of low end stuff is that acid reflux stuff, but then irritating the stomach, having stomach problems, and then we're getting into ulcers, and having problems with internal bleeds and stuff like that as well. And the pancreas too. Oh my God, there's like so many parts of the body. It's like literally every part of the body. Yeah, bowels, pancreas. So another really common one is acute and chronic pancreatitis. But there are other reasons why you might have pancreatitis. Just because somebody has pancreatitis, it doesn't mean they have a drinking problem. There are other reasons why somebody might have pancreatitis, such as genetics and gallstones. But it is super common with people that are drinking more than their body can cope with. We don't really know why that happens. But, you know, if you're somebody, so the bottom line is, if you are somebody that struggles with your memory, if you are somebody that struggles with anxiety and depression, if you have tingling in your hands and feet, if you are concerned about your cancer risk, or you've had, you know, sort of cancer warnings, or you've had cancer, if you have liver problems, if you have heart problems, if you are a stroke risk, if you have stomach problems, you know, all of these things are warning signs that are basically like, just stop drinking and look after yourself. Yeah. I've got a few things I'm going to share with you that will go with this and go into more detail. Now, the problem with this is people will listen to this video and you will think I am scaremongering. And it's really difficult, isn't it? Because if you drink alcohol regularly over a period of time, it's a lottery, I would say. Yes, we all know people that, you know, are 80 and have smoked and drunk all their life. Well, that's where genetics and maybe lifestyle is a factor, but that's unusual. And as much as it's unusual to see somebody who's 21 with liver problems, we used to see men sort of between 40 and 50 with liver problems, and then we started to see women coming in earlier with liver problems as well. And we're just generally seeing, you know, an increase in diabetes, in heart problems, in strokes, in cancers, and all these things are impacted by alcohol. So I would say to you, if you are concerned about your health in any way, you know, you want to live a long and happy, healthy life, then the less alcohol, the better. Because we know categorically 100% that alcohol will cause, increase, exacerbate, and include your risks of all of these things. Yeah. So dementia, Alzheimer's, peripheral neuropathy, 7 types of cancers, liver problems, heart problems, blood pressure, strokes, diabetes, stomach problems, pancreatitis. We know that mental health problems, we know that 100%. And this is where you have a choice. So we talk about 14 units being the recommended guidelines, and it is just a guideline. So what we're saying there is, we're saying if you drink 14 units a week, you are probably going to be okay. But we can't say that categorically, because there may be a small number of people where alcohol is still at 14 units going to impact on them in some way. Yeah. Again, genetics and lifestyle play a factor. So we always say, if you want to be healthier, the less alcohol, the better. And if optimum health is your goal, then no alcohol at all. Any questions, please ask, and I will post some links with this video. Thank you.